It's very warm. It's very warm. Everyone that walks in here comments on it. I think they expect white walls everywhere. It's just a nice, calming atmosphere.
Well, we're just in Aberdeen. Even if you look at us, our dry area might be about 80,000. And when I initially came here, I wondered too, 26 years ago, that whether there'd be enough, cancer here for me to do the job or to take care of this region. And we probably have come in just through those doors every day, maybe 100, 150 people, maybe 50 of them 40 to 50 to see me and Chris Nelson, my nurse practitioner. Then we have, maybe 40 or 50 getting treatments, and we might have another 40 or 50 just coming in for labs. So it's a lot of people are coming through, and that's why we needed a big center.
They estimate that between 2010 and 2030, there'll be a 43% increase in cancer. And it's because the baby boomers are starting to move into that age range. And so I think that it's important that there was an expansion, because this is not going to become a smaller population. It's actually a growing population, unfortunately.
And if I remember the numbers correctly, I think it's 21,000 people that die per day of cancer globally. So every day you wake up and you think, that's how many are going to die. But the figures have improved tremendously in breast. They've improved tremendously in a lot of other fields, so there is a lot of hope. So when I did some of my initial trials in the late 70s and 80s, it was basically a 40% survival rate at about 10 years. And at the moment, the figures quoted are at 87%. So it has changed staggeringly in the last 30, 40 years.
Nice. There you go. They've won the battle. Yep.